Hi, everyone. So happy to be here for another Care Connection with all of you. And this one specifically doing a special edition with Bethann Nelson. She's the director of NYS Senior Medicare Patrol, and she joined statewide in July 2018 as an outreach counselor and was promoted to the director of the Senior Medicare Patrol program later in October 2019. Beth has numerous years of experience in working with the senior population, specifically as a service coordinator in HUD subsidized housing. And she also worked for Erie County Department of Senior Services and their cluster offices in South Buffalo and Amherst. Beth serves as a mentor for the WNY Service Coordinator Association and is a member of the Council of Elder Abuse in both Niagara County and Erie County. So I'm really excited to have her here today with us to discuss, the prevention of fraud that we see in healthcare. And without further ado, I'm going to let her take it away. And just one housekeeping is that everyone is on mute, but if you have questions or anything throughout the presentation, just type it into the questions box. And then you'll find in your chat box, there is a link to a survey about the presentation that you can fill out afterwards. Okay? All right. So Bethann, take it away.
Thank you so much, Kara. I so appreciate you asking me to speak today. I'm really looking forward to hearing from everybody in this group. So I hope they take some great notes and have some great questions. Today we're going to talk about Take Charge, and it's how prevent healthcare fraud and abuse. Oh, and I'm running my own slides because I keep forgetting that I'm doing it. All right, so New York Statewide Senior Action Council is a grassroots membership organization made up of individual senior citizens, senior citizen clubs, and organizations from all parts of New York State. We have a long history of providing outreach and education to senior citizens since 1972. So we are coming up on our 50th year anniversary. And I'm very excited about that because I know we'll be back in person, and that will be really wonderful to see everybody who is part of statewide. And we are also a group that is governed and directed by seniors and advocates for seniors on a grassroots level. We have 3 programs. One is our Patients' Rights Helpline. We also have managed care counseling and assistance. So we do help people during open enrollment, special enrollment, if they want to change plans or they're just curious if they're the plan that's better for them that will meet their healthcare needs. And we also have the Senior Medicare Patrol program. In 2018, we received a grant from the U.S. Administration for Community Living. We are now in our 3rd year of this grant. And it's to help prevent Medicare and Medicaid fraud among seniors in New York State. Senior Medicare Patrol empowers and assists Medicare beneficiaries on how to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So how does the program work? Through community outreach, educational presentations, and distributing information. We have growing groups of volunteers. I currently have about 57 volunteers in New York State. I'm always looking for more. And they serve as the eyes and ears of their communities and disseminate materials about our program. Excuse me. Normally, our volunteers are very busy. Congregate dining sites, senior centers, any kind of outdoor event that happens in the summer, whether it's a picnic for seniors, whatever it might be, they are there and they are part of it, and they share a lot of great information. We also have certified unbiased counselors who provide assistance to the public and work with the U.S. Office of the Inspector General to resolve cases. So what is Medicare fraud? Medicare fraud is the intentional billing of Medicare for services that were not received, or billing for a service at a higher rate than is actually justified. The key word to any investigation regarding Medicare fraud is, was this intended to defraud Medicare? So as you can tell, there are many types of Medicare fraud. Whether it's ambulance fraud, durable medical equipment, I'm not going to read them all, but I'm going to talk to you about a couple. So ambulance fraud. Most people, hold on, sorry. Come here. Sorry about that. She's sleeping, and I guess somebody decided to walk by. All right, so
Nope.
ambulance fraud. Most people look at the bill and they just look for your copay. So if you know that you have a $75 copay, $150 copay, that's all you look at, and you say, okay, that's what I owe according to my health insurance plan, and that's what I'm going to pay. But what you really need to look at is what's inside of the bill. How many miles did they charge? If you only live 8 miles from the hospital and they charge 50, I would question that. If you did not need a paramedic, let's say you just had a broken arm, you don't need a paramedic for a broken arm. But if they charge you for a higher level of care, advanced life support, you need to question why they're billing you for that. Why was there a paramedic? Why are they billing for a paramedic service when you did not need one? All right. Genetic testing fraud. Genetic testing fraud used to just take place at vendor events. So you went to a community event and there was a table set up and people would say, I can test you to see if you have cancer or if your medications are working with your body. And people would give their information and they would do a cheek swab, only to never get the results of their cheek swab, because the real deal is they only wanted your Medicare number. Medicare only has one approved genetic testing screen, and that is a colonoscopy. It is not a cheek swab. If you believe you have cancer or your medications are not working, then we encourage you to go to your doctor and have your doctor order testing to find out if indeed you have cancer, if your medications are not working. But don't stop at anybody who's at a table at an event that's going to do that, because they are only there to steal your Medicare number. The last one I want to talk about is medical identity theft. I recently had a lady that called me, and what she said was, hello, my name is, I'm 92 years old, and do I sound dead to you? And I was like, well, no. And she said, well, according to Medicare, I'm dead. And they denied, she had gone to the doctor, she had the blood work done, and it said the reason why it was denied was because it was after her date of death. So what happens with this? What happens with this? Someone used her Medicare number. They were sick. They took an ambulance right to the hospital. They were in the hospital for 10 days and then they passed away. All this while, the hospital is assuming it's this 92-year-old woman. They're treating her. And by the way, this person is on pain management medication, all kinds of things that we don't know if the person who passed away had any of those issues. And now, because her Medicare is saying she passed away, they notify Social Security. Her only source of income is her monthly Social Security check. So what we had to do first, and luckily she caught it, she read her Medicare Summary Notice, and she caught it. We were able to get a hold of Social Security, prove that she was still alive, so that she didn't lose any income. And then we had to work with the actual problem. We had to notify the ambulance company and the hospital that she was still alive, in Medicare, obviously, and go through the steps of resolving all of the issues. And Medicare asking for almost $70,000 back that they paid for her stay in the hospital. So you really need to remember, once that Medicare number has been compromised, things can happen. And this 92-year-old lady is one example of how things can go really wrong. Her doctor, her primary, would not even see her until the issue of her being alive and getting a new Medicare number were resolved, because Medicare denied her visit and didn't pay the doctor. So I just want you to remember that when we talk about different types of Medicare fraud, and there are many more than this, that the key is we really want to protect your medical identity. Just like you have a financial identity, you have a medical identity. So all of this is very important to, when we'll get into this in a little bit, making sure that you read your Medicare Summary Notice and your explanation of benefits so that everything on those forms are accurate for you. Examples of Medicare fraud: billing for services supplies that needed, excessive medical supplies, obtaining or giving a Medicare number for free services. By the way, that's a felony. Improper coding to obtain a higher payment. Some doctors order excessive x-rays and lab tests, claims for services that are not medically necessary, and using another person's Medicare number or letting someone else use your number. And that is the same thing also with your Medicaid number. If you let someone use your SIN number, then your medical identity has been changed. So we have 3 steps to prevent Medicare fraud. One of them is obviously to protect it. Never give out your personal information. For example, your Medicare number to someone you do not know. We always tell people to detect Medicare fraud, to read your Medicare Summary Notice and your explanation of benefits. Look for services you did not receive, services different from what you received, and services that were not medically necessary. I had a gentleman who lived in the southern tier here in New York State, close to the Pennsylvania borderline. And the doctor that he went to was in New York State, and the doctor ordered lab work, and he did go for his lab work, but the lab work was sent to Pennsylvania. That's where I guess they send all of their lab work. But the gentleman called me, he was adamant that he did not go to Pennsylvania. He had never been to that company. He had the blood work done at this clinic, and this was fraud. Well, I called the clinic, and I found out that that's where they send all of their lab work to be analyzed. So if you see something that you don't know what it is, I advise you call and find out. If you don't get an answer that's satisfactory to you or sounds fishy, then give your state senior Medicare patrol a call and have them check into it for you. We also always want you to report cases of suspected Medicare fraud in New York State to the New York State SMP, which is my office, at 1-800-333-4374 with questions or to report fraud. So today we're going to talk about understanding Medicare documents. There's 4 types of Medicare: the Medicare Summary Notice, Medicare Resources Online, and your explanation of benefits. Now, I will tell you, when I was helping take care of my grandmother, I did not understand what a Medicare beneficiary notice was. I was probably 23 or 24 helping out. I wish I would have known this when I was younger so that I knew what I was looking for to see what was going on. It was something that came in the mail, said this is not a bill. So I can honestly tell you I did not pay a lot of attention to it. So who knows what could have really went on with it, the services for my grandmother many, many years ago. I think it's really important to remember that these are your tools to make sure that your medical identity has not been altered. Because quite honestly, if you go to the hospital and you have an altered medical identity, they could treat you improperly, or you could be denied services that you need because somebody else is already receiving them. So types of Medicare coverage. Medicare Part A covers your hospital insurance, such as inpatient hospital, skilled nursing, facility and home health, and hospice care. Medicare Part B covers your outpatient visits, doctor visits, lab tests, medical equipment, ambulance, immunizations, and more. Medicare Part C is not just an Advantage plan, it is also your supplemental plan. So if you have, I know in New York State we have like ARP has a supplemental plan, and that is Medicare covered benefits and others according to the Medicare Advantage plan or what your supplemental plan will cover. And Medicare Part D is your prescription coverage for your medication. So what is the Medicare Summary Notice? It is a summary of healthcare services and items received during the past 3 months. Now, I will let you know that not everything is always on there. It will depend on when the billing office submitted the information. So you might see something like looks a little bit out of sync, just date-wise, between the date of the summary notice and the service, only because of sometimes how things work in an office. It is sent to people with original Medicare. It is not a bill, and it lists any services that are denied or not covered by Medicare. So here is an example of what your page 1 is going to look like. So what we always ask people to look for are a few things. The Health and Human Service logo needs to be on here. It also gives your information. So it'll have your name, your Medicare number, the date of the notice, and the claim period. So if it's going to be January to March or April to August, whatever it might be, it's usually 3 months. That will be on here. It's also going to tell you your deductible status and where you're at. So if you've already met your status based on a hospital stay or doctor's visit, that's going to be listed in here. Your claims and costs, and the facility with claims during this period. So as you can tell on this one, somebody had gone to the hospital, but you need to make sure it says also, this is not a bill, so that you know that it's the Medicare Summary Notice. It is basically recapping services that you received in a 3-month time period. It is the same thing for your Medicare Part B, and it was going to give you the same information. The Health and Human Service logo is going to be on here, your information, once again, your deductible information, claims and costs, and providers. And once again, we'll say this is not a bill. The things we want you to look out for is the location. Were you billed from a different provider, a different city, a different state? Date of service. Were you billed for a service you were not seeing? And duplicate billing. Were you billed for a product or service more than once? Now, I know that sometimes if you go to, let's say, an emergency room, you're going to be billed for the emergency room. You're going to be billed for the doctor who treated you at the emergency room. And you might also be billed for like your prescription drugs or any other x-ray. So you really need to read your bill and see what you are being billed for. And any questions that you have, you need to call and ask. So whether it's the provider or the actual emergency room that you're calling, or if it is one of your state SMPs, do that so that we can help you out so that you are clear that these were services that you received. So red flags on an MSN. So what they have on here is a provider. And is this the correct provider that that person went and seen? And then it has the dates of service. So we want to know, does this date match up with the date that you have? Also, the question is, if you live in Connecticut, did you really receive services in Ohio? So that's a definite red flag that you want to make sure your provider, the actual location and date of service, and do any services appear twice when they shouldn't. So you need to really read these and make sure that these are accurate. And if not, then you can call and we can dispute this claim. Medicare has many resources online. And if you don't have an account and you are comfortable going on the computer, you can visit Medicare.gov and create your own account. And you can also get your Medicare summary notices electronically if you so choose. The great thing about doing it online is that it's day to day. So if you went to the doctor yesterday, you should be able to go and check it today, and you will see what you were billed for and what services supposedly took place. Hopefully are the correct services. But it's better than waiting every 3 months, because something might have happened in January and you're not going to know about it till April. So if you're right on top of it and you're checking your Medicare summary notices often and you're getting them online, you can pull them up as often as you want and check out what's going on with your situation. So what is an explanation of benefit? And we call them EOBs. So those are for people enrolled in Medicare Advantage plans or supplemental plans. And it's a summary of services and items you received, how much the provider billed you for, and how much the plan will pay, and how much you may owe. It's, once again, it's not a bill, and it's usually mailed once per month and also may be accessed online. So what we want you to do, excuse me, is read about the information and services listed in the notice carefully. Check if an item or service is not covered. Look for a section with comments or footnotes to find out why. If a service you received is not covered, you can appeal, and this will be on the final page of your explanation of benefits. Your explanation of benefits, keep them so you have a record of payment made by your carrier in case you need it in the future. And I'm not saying keep 5 years of them, but then when you get the next Medicare summary notice, compare it, hold on to it for a while, and maybe until you get the next Medicare summary notice, just so that everything matches. Everything will match up with what your Medicare MSN, Medicare Beneficiary Notice, is saying, and your explanation of benefits. If you have any questions, you can call us at our helpline. In New York State, that's 1-800-333-4374. So once again, it's always reviewing. So compare your doctor's bill and your explanation of benefits for dates, providers, types of service, and billing codes. Make sure you're not charged for services you did not receive or billed multiple times for a service you only received once. And if the insurance company rejected a claim, look for a note or reason code explaining why. If you suspect billing fraud, contact the New York State Senior Medicare Patrol. It's a free and confidential service at 1-800-333-4374. Now, we have a tool that we believe you can use to help keep track of your medical appointments. It is called the Healthcare Tracker. And every state has an SMP program. So every state actually has an SMP Healthcare Tracker. That if you are interested in receiving it, it's like a healthcare journal that you could call and they would send one to you. And this is really a great tool to help kind of organize everything, because your notes are right there. I went to this doctor that day. This is what I had done. It gives you a lot of good information that you can write down and use. And then you can compare it to your explanation of benefits and your Medicare summary notice. And just like the lady who called me and who's 92 years old, said that Medicare was saying she was dead. Basically, if she wouldn't have read her Medicare summary notice, and wouldn't have kept a record of, I've never been to that hospital because these are the only 2 hospitals I've ever been at. I did not do anything that day. I was not in an ambulance. If she did not have that record, she wouldn't, and read the Medicare Summary Notice, she would have never caught the fact that she had expired until Social Security caught up with her and stopped sending her her monthly check. So a healthcare tracker is a useful tool for spotting potential problems with your MSN and your EOB. The healthcare tracker includes pages for important contacts and your personal information, allergies and personal habits, family history and health problems, immunization record and medication, medical equipment and supplies. If you're using a walker, what store did you buy that from? Or if you have a knee brace, what store did you go to get fitted for your knee brace? Operations and surgery is very important because sometimes the doctor will maybe have the incorrect record. I've had that happen to me. In the town that I live in, there are 4 people here named Bethann Nelson. We all go to the same library, same dry cleaner. We've never met, but I do know we were going to the same doctor. And when I went to the doctor, they pulled the wrong file, and they said they were sorry to hear that something had happened to me. And I said, no, I just got out of the hospital. I just had a baby, and I'm just coming in for a wellness check. And they ran, I mean, they had to cross out notes, they had to initial them, they had to pull the right file. But I'm just saying doctors can make mistakes. Nurses can make mistakes. They deal with a lot of people all the time. So you need to be on top of what is going on so that it's definitely you and your record that they're dealing with. So, and there's also a page in the tracker to keep track of your own health history, physician, and care provider appointments. I recommend you use this. So, what to look out for? With the personal health care tracker, you can use it when you receive your Medicare Summary Notice or Explanation of Benefits and compare the information on these forms with your personal record. So, like I said, you're going to have notes in there. You're going to say, oh, today it's June, whatever, and it's not. I'm just making up a date. And I went to the lab for blood work for the following reasons. And I have a follow-up appointment with my doctor in a week. And you can write that all down in your healthcare tracker. And then when you have that appointment, did you see the doctor? Did you see the nurse practitioner? Was it a Zoom visit? And for Zoom visits, those virtual telehealth, it is really important that you keep track of your visits. Telehealth is such a major problem with fraud right now that it's really, really important that you write stuff down and that you know that you're talking to your doctor. So one of the things that I am always looking for are volunteers who are interested in going out in the public and talking to people about Medicare fraud. Today we really just did a Medicare Summary Notice presentation because it's such an important tool in protecting your health identity and seeing if there is any fraud going on with your situation. The Senior Medicare Patrol volunteers help Medicare beneficiaries protect, detect, and report Medicare fraud. They make group presentations. They staff exhibits at tables and events. And I have to tell you that since we've been in lockdown here in New York State for over a year, I actually am taking a volunteer to an outdoor event, and she's very excited because she hasn't been anywhere in over a year, and she can't wait to get out and talk to people. We also have people that prefer to just share and distribute information to their communities. So we have some volunteers that only go to 1 or 2 senior centers, and they bring our flyers and they share our information, and that's fine too. If you're not into speaking, you're into handing out information, and we appreciate it. So if you have questions about fraud and you live in New York State, we want you to call New York Statewide Senior Action Council at 1-800-333-4374, and that's to report suspected fraud, abuse for training, speakers, or materials. And if you live out of New York State, the national number, the nationwide phone number is 877-808-2466, and they will direct you to the correct phone number to call. There is an SMP program in every state. There's one in Puerto Rico, Guam, DC, Virgin Islands. So anywhere that you go, there is an SMP program, and that 877-808-2468 number will head you in the right direction.
Mm-hmm.
Yeah. So I don't have this. Hold on. If I can get rid of this, I'll leave it here for now.
Yeah. And so we do have some people who have questions, and, as we go over them, if any of you while you're on here have questions to put in. So Beth, the first person has asked us, just briefly back, with the genetic testing specifically, did you mean the Cologuard test or a colonoscopy?
I think the Cologuard test is considered a pre. I believe that that's covered. But as I said before, it's not a cheek swab. So it's not somebody going to take a sample out of your mouth. And those tests are not covered. There are many rules and regulations and a lot of documentation to prove that you need a genetic test.
Okay.
Genetic screening, those two tests they're covered by Medicare.
Okay, that's good to know. And then I have a woman who, I'm going to share her story, and then kind of, she said her mother was in memory care, and, the doctor was originally coming once a month, but the charges were, a lot. And so from there, they just, with the memory care, they decided that they would agree to have her do a quarterly check. However, the doctor is still charging them monthly. So is this something that she would want to then go to her nationwide toll-free, state to call and follow up about?
I would definitely follow up, because maybe the doctor is calling the facility and checking on her status, or maybe decided that because she's in memory care and there's no issues going on right now, that the quarterly visits were fine, but then the doctor should only be charging for quarterly visits. So definitely call whoever your statewide senior Medicare patrol is, and like I said, use that 877-808-2466 number, and somebody will tell you who you can contact in your state.
Okay, that's good to know. And another person I had, they asked, about the explanation of benefits. Is that something that you keep long term? And also, if they are in paper form, do you need to keep them if you make an online profile?
If you're going online, they're going to always be online.
Okay.
If you're getting them mailed to you, I would keep them for a bit.
Okay.
And that's talking a year. I would just match up when you get your Medicare Summary Notice, which is quarterly. I would match those up. And if they match, shred them, no problem. If there's an issue, I would hold on to them until the issue is resolved. By then you would get a new EOB and an MSN saying that, this was appealed, this is the decision, or, you will get a notice saying, looking into this. But I would hold on to it if there is an issue. And if not, when you get your Medicare Summary Notice and you have your EOBs and they match, then shred them.
Okay, that's good to know. I do have another person who followed up. And how would you know about billing codes if you're someone who doesn't really know about them and if they were done wrong?
All right, so one of the things that I found out that I found very interesting is that you can actually Google them. So if you go online and you Google Medicare billing code, then you put in the number, it will actually tell you what you were billed for.
Oh,
Yeah, I know. I didn't know that either, but I ended up talking to someone in a high cap, which is a health insurance program. Because I was like, I need to find out what this code is. How do I find out? And they said, oh, Google it. I'm like, you're kidding. And they're like, no, just Google it. So I did, and it was exactly this person. He had a phone call with the doctor's office and ended up speaking to the nurse, and it was about medications or whatever. And that code exactly is what happened. So I was surprised. So if you can go on the computer, I would Google them. If you can't, then you need to call and ask them, this code, what does it mean? Like I said, call your senior Medicare patrol and have them Google it and look for you.
And it's just a way to clarify what it is. So that's good that that's an option to just seek more clarification about the services, you received or your person received.
Yeah, definitely. And you want to know, because the reality is that that person doesn't know, right? I mean, I know with my grandmother, if I would have said to her, did you see the doctor today? She would have told me no, even if because she just didn't know. She really was at a point in her life when she didn't know. So if you're the caregiver, you're the person helping out, or you're the person responsible for all the paperwork in the family, right? And you really need to know what they're billing, because a lot of times doctors and they already know that your loved one doesn't know, right? They're there. They have memory care issues or memory issues. So you don't know what's on those bills unless you really check them out. And like I said, when I was in my 20s, I wish I would have known, because I was definitely more on top of it. And look more than, grandma, did you go to the doctors? Did so-and-so take you to the doctors? And she would always say, oh yeah, or oh no, and so I never really knew. And I wish, I won't tell you how many years ago I would have known that, but probably over 40 years ago, that I would have known, because I really would have stayed more on top of it.
And I think it's important to mention because, we are seeing more millennials having to go into that caregiver role, for their grandparents. And we're also seeing, right, those definitions of, different types of families. And so we're seeing the caretaker role, changing. And, with Alzheimer's and, any of the dementias, it's increasing. The amount of people that are having it. So at this rate, there's going to be a lot more of it. So learning this stuff now will be super helpful.
Yeah, I know it's a challenging position to be in.
Yeah.
The caretaker, you have so many things that you have to take care of. I mean, just dealing with the person and making sure they're dressed appropriately and they ate and that they're doing okay that day, and getting through the day, because there are times of the day that that could be challenging. And now you have more paperwork you have to read, so it's I think can be a very overwhelming thing, but I think this is a very important piece of information, not because of there might be fraud and you're being extra billed or erroneously billed for some reason. But when I look at the end result of having your medical identity compromised, what kind of patient harm is that? So if they think this lady was this 92-year-old lady who was already taking narcotics for pain, and now that this other person is sick, and they're looking at the person who's alive, the medical record, what treatment they gave this person who passed away.
Yeah.
I can't speak for it, but if they were going based on wrong medical records, and I'm not saying that along the lines, obviously there was a huge error, and I'm not saying that that's why this person passed away. I'm not saying that. But what I'm saying is if they used her information, it was the wrong information. It was
Yeah.
the wrong. So it could be, in my opinion, it could be a deadly error,
Mm-hmm.
the wrong information.
Exactly, because it's tied to your health care and your medical records. And so whatever's, attached to it, if unfortunately someone, gets a hold of it, that's definitely something that can be a concern. And speaking of that, I do have someone who asked, what are some of the other, I know you gave a lot of examples of different ways, but how other ways in terms of Medicare numbers are getting stolen that you're seeing?
All right, so what I do know, and they're not really saying, so there isn't anyone saying, yeah, they broke into our system and they stole this. I do know that in New York State, there was a huge data breach with all the hospitals in New York State. I saw a big article in the papers, oh my God, huge data breach. Not a peep since. I have not seen anything that says this is the information that was stolen. So based on what I'm seeing, and what is going on in different areas of the state, especially like people already having Medicare numbers and sending durable medical equipment, I believe that maybe Medicare numbers were stolen. I can't say that 100% true, but I can't find another way that everywhere in New York State, these boxes are just showing up with Medicare numbers already on the invoice,
Mm-hmm.
the front page. I don't, it's because they're being investigated, they're not giving senior Medicare patrol people all of that information so that we can go and say, oh yeah, by the way, that data breach in 2014, they stole. I mean, they're just not giving us that information.
Mm-hmm.
Just like as I'm not going to tell you the name of the hospital or the name of the ambulance company or pharmacy that constantly shorts people pain pills. I can't give you that information. And I think that's how the whole situation occurs. But the media got a hold of something and then it dropped because now it's being investigated. And we might not know for 10 years what's up with this data breach.
Yeah.
So I'm sorry. I wish I could answer your question. I honestly can't because I really don't know. So.
Yeah. And it's hard because there's different ways that people, are being more creative in terms of getting people's information, in terms of, finding out their Medicare number. As Beth said, if you're sharing your information with someone who maybe shouldn't know your Medicare number, that's always a cause for concern in terms of that.
So, and that is one of the things that I was even talking about earlier a little bit with telehealth. So telehealth it's a fantastic service, especially with the pandemic, right? So those who didn't want to go into a doctor's office for fear of getting sick, and we all had that fear. We didn't want to be around other people or be in a waiting room with maybe 20 other people. So it was a perfect solution. But telehealth already had many fraud cases attributed to it. And then when you look at the time frame, so in their state they were saying 15,000 beneficiaries a week were doing telehealth. Right? Because they lived in a rural community, it was easier for them to do telehealth than drive hours to a major area to meet with a doctor. So Medicare actually expanded telehealth services. They added 144 new services to telehealth. So when you look at the time period between, I think it was March and I'm going to say December because I'm pretty sure it was December. It was like over 250 million people had telehealth visits. I mean, what a huge number. But the problem with telehealth is people are calling and saying, hey, this is your doctor's office and we need to schedule an appointment. And then when you're on the phone with them, they want your Medicare number, your address. all of this information, something needs to click and say, hey, no, you're not my doctor. You know, so I always tell people when they get those calls, hang up. I want you to be your own doctor. I want you to schedule the appointment so that you know what time is your doctor going to call you and either Zoom with you on the phone or chat or do whatever it is that they will do in order for your visit. But people that are calling you, those are not your doctor's offices. Those are just people hoping to get your Medicare number. And people want, I mean, they want your number. They want to use it. They might not use it for a couple of years, but they are going to use it. And that's why reading your Medicare Summary Notice and your EOB are so important. You know, we want people to stay on top of, and we know from surveys that we've read and whatever, only 44% of people read their Medicare Summary Notice and their EOBs. So about it, there's a lot of people that who knows what they're being charged with or for if they're not really reading them.
Exactly. And, you know, I had someone who asked, you know, what are, and I think this is something, you know, that's going to come up because as we mentioned, this is going to be, we're going to be doing several presentations, you know, on this topic for many of you in terms of how to protect yourself. And we have one coming up and I'll share that information towards the end of the next one. But we do have someone who asked, you know, what are ways that themselves can protect their Medicare number and that their caregiver can protect their number?
All right, so the best way to protect it is pretend you do not have a Medicare card. I mean, really, you only need to take it one time to your doctor's office, right? They put it in your record, and there's your number. Same thing with your, you know, if you have a Medicare Advantage plan or a supplemental plan, they have it. If you go to the pharmacy, now in New York State, we have a thing called EPIC, which is a prescription assistance program. So you might, when you go to your pharmacy for the first time, bring your Medicare card, bring your Medicare Advantage card or supplemental plan card, and your EPIC card, because then it's on file. Nobody needs it. I mean, if you're going to the grocery store, you don't need your Medicare number. And quite honestly, if you fall at the grocery store or you're in a car accident, the ambulance company does not need your Medicare number. When you're done with whatever happened to you, you can then report to the ambulance company or the emergency room or wherever, urgent care, wherever it is that you end up going, you can give them that information later. So you don't need to carry these cards around with you because there's nothing that's going to be like immediate. Call them tomorrow, or you have to call them next week and give them your numbers, but you know who you're calling, right? You're going to call the billing department of the ambulance company. You're going to call the billing department at the emergency room, so the hospital or facility that you went to. You're not just going to give it to some paramedic or EMT person who just happens to be riding by, the grocery store clerk who's looking for your name going through your wallet because you fell outside. So you don't need that information. You just don't share it. Don't give it to people. And especially if you're, you know, just getting a cold call, well, we need your Medicare number in order to. No, they don't need it. Nobody needs it. The only people that need it are your doctor. So,
and I think that's the way to put it. I always, you know, on the helpline that we have here at AFA, you know, many times when we talk about it, Medicare is not going to, you know, call you and be like, wait, we don't know what your number is, and things like that. And that's where it can be, you know, it feels like that pressure to answer, but they have the information.
Yeah, Medicare is not going to call you, just like the IRS is not going to call you. Just, I mean, it's the same kind of scam, and there is that whole pressure tactic. You know, you stop your benefits, we're going to do whatever. But the reality is that's not true. And quite honestly, if someone from Medicare has a question about something, they're going to send you a letter. Just like the IRS is going to send you a letter, Department of Labor is going to send you a letter. No one has that manpower time to stay on the phone and call all of these people. It's like getting a new Medicare card. You are not getting a new Medicare card. Tell you, you're getting a new black and white COVID Medicare card. You are not getting one. You are also not getting a new Medicare card with a chip in it. Nobody needs a Medicare card with a chip in it.
Yeah.
So I think a lot of it, like you said, though, is the whole, oh my God, you know, I got to give them my number and this is the problem. But the reality is that your number is your number. And unless your SMP tells you to call to get a new number because your number was compromised, that's going to be your number forever. And things that I had a daughter who called me who said that her mother had given out her Medicare number, but had dementia, but she knew exactly where she kept the card. So it was in the same place it's always been. The mother knew exactly where the card was, went and got it, and gave out her number. So I told her to go online and make a fake card and put it where her mother thinks her Medicare card always is.
Yeah.
And I don't know if this is a legitimate tactic or not. I just said it was like a great idea. Like make it look like a Medicare card, right? Put it where in the where her stuff is. But then in the meantime, when you get the new one, take the new one and keep it and hide it.
Yeah.
So, and I know it's deceitful, but it's also safety because you know.
And we kind of call it, you know, therapeutic and compassionate lies, you know, because we're trying to keep that person's safety in mind. And unfortunately, they don't have the capacity to rationalize anymore because of the brain disease. And so is one of the approaches, you know, and, you know, just to share, we also, you know, do it with like credit cards and stuff, you know, this way, because sometimes it's not so much about what it actually is. They just want that feeling of like having that piece of paper or that card and that they you know, can hold on to it. And so that's actually a really good example to use, especially if someone's, you know, very attached to it and they don't want to let go of it. But then we also want to make sure they're safe. So it's definitely a way to look at it.
So when I came up with that, I was like, oh, I probably said like the wrong thing. But then I was like, you know, if my mother knows exactly where everything is, right? I always remember what she had for lunch, but and, you know, she's 92 and life has become a little bit challenging. But I would personally cancel the card and leave it and apply for a new one. And I would just say, oh, she lost it, and I need a new. I want a new number. I want to, you know, whatever.
Yeah.
Because that way I know it would make my mother feel better to look in her wallet and there is her, you know, whatever card she's using. Drive anymore as of a couple of weeks ago, so she doesn't need to worry about all those charge cards and whatever. But I think it's her safer because if someone were to call her and scam her, they would get a card that's closed. So I kind of do the same thing with your Medicare card. You know, you're just going to get a new number. Right, family member is going to keep that information. So,
and it's a good caveat, you know, to that. This is a really good, useful, you know, tool when you have someone with with a brain impairment, to where we're trying to make the person happy, but we're also trying to keep them safe. And you have someone who asked that should this person consider reporting a hospital if they've been incorrectly billed for their husband as a different person and name, and if it's happened multiple times?
Yeah. That you should actually contact the Senior Medicare Patrol and Medicare. I know at least in New York State, they refer them back to me because they want to make sure I have a record of it and I'm reporting it to the Office of the Inspector General. but I would definitely report all of that. Because now what you need to do also, you want to get medical records because you want to make sure that your husband's medical records are accurate.
Mm-hmm.
I'm saying that he has a heart problem if he doesn't have a heart problem or whatever it might be. Because if he really, he goes to the hospital and he needs treatment, we want to make sure that he's having the appropriate treatment.
Exactly.
It's something I would definitely start working on. Because there are issues that could be life damaging.
Mm-hmm. And like you said, it could be a scenario where we find out someone's getting the wrong type of medical care. And, I've actually had someone on the helpline call saying that they got a prosthetic leg sent to them, and they weren't amputee at all. And so that was kind of concerning in terms of them receiving that.
Right. So, yeah, you really that is why it is so important to read those key documents, your Medicare Summary Notice, your explanation of benefits. But things happen, right? So maybe you end up going to the emergency room in the hospital. You have to be there to advocate and make sure it's all correct. And if you find that you're even getting billed incorrectly, you definitely need to take action. I know it's more time and more energy,
Mm-hmm.
caregiver, but in order to keep your loved one safe, it is what really needs to be done to help them out.
Mm-hmm.
Report
And
it, please.
it's a way like where when you do place the call, right, to the senior Medicare patrol, right, if you're, whatever state you're in, it's a way to communicate with who's there. And doing it the first time, now, if you see something again, you know how to go about it. And it's like we would be able to talk to like a person like you, Beth, and be like, oh, this is what we're seeing. And then that's, in a sense, as a caregiver, to help with some of the burden, because you're getting to consult with someone, an expert like Beth in a situation that might present itself.
Right. Definitely call. Do not, someone will get back to you.
Mm-hmm.
You're calling the national office, which is, where are they? I want to keep saying Iowa. But they will pass the message on to the right person in the right state, and they will get back to you.
Mm-hmm. Yeah.
There's someone there to help you straighten this out and take care of it. And that's what's really important. That's what's needed. So please call.
Yeah.
Get the help that you need.
Exactly. And before we wrap up for today, I do just want to let you all know that we have our next presentation scheduled it's going to be Monday, June 14th. It's going to be 2 p.m. to 3 p.m. And this one, because I know there were specific questions on what are places doing about it, about scams and things. We have two speakers who are going to be joining us to discuss how to avoid elder fraud scams and really go into depth on them. So I will send a follow-up email with that information, with the general certificate from today that we had with Beth. But then that way we're going to further continue this discussion, because one time is just not enough time to go through all the different things that come up from it. So we'll be able to touch base a little bit more on different upcoming steps.
All right, so, and I would like to just ask everybody if they're able to click on the survey. We're in survey time right now, so I need some people to fill them out and send it in. I do not know what's on the survey. I have not seen the survey, and obviously if you do it online, it's not going back to me. It's actually going to ACL, which is the Administrator on Community Living. Normally we do paper surveys.
Mm-hmm.
In the reality this year, because we're all on Zoom or WebEx. So I would appreciate it if you could just take a few minutes to just fill that out. Thank you.
What I'll do, Beth, is I'll also put it in the email for there as well.
Okay,
So
great.
that way, let me just put that on there so that way when I send everyone the follow-up. So thank you, Beth, for being here with us today. You know, I had a few people mention, thank you, this webinar is so great and helpful. I wish I knew about this years ago and knew about this organization. And so I'm really glad you were able to take time with us today.
I'm really glad to spread the word on Medicare fraud and the importance of your medical identity. And I look forward to seeing everybody next month.
All right. Same and likewise. So everyone have a great day. We're going to wrap up for today and we'll see you on June 14th. Take care.
Thank you, everyone.